Minister, commitments have been given in the last two programmes for government to introduce a no-fault vaccine compensation scheme, and this was again promised by the Taoiseach Micheál Martin in advance of the introduction of the COVID vaccination programme. Now, my engagement on this issue with various ministers for health has been ongoing for the last 250 months, or over 2 decades. And Minister, we now have claims related to adverse reactions from the COVID vaccination programme. So my question to you is, when are we going to see a compensation scheme introduced in this state, as is the case in many other countries across the globe?
Thanks very much, Deputy, and can I acknowledge your very long-standing work on this issue. My department and the HSE are working to monitor and improve patient safety, reduce adverse incidents and harm, as I know you're aware. The Government did recently approve the establishment of an interdepartmental working group to examine the rising costs of health-related claims and consider mechanisms to reduce this. The group will examine the rising cost of clinical negligence claims in the health system, with a particular focus on the high-value claims, many of them coming out of obstetrics. The group will identify measures that we can put in place to reduce further costs, but actually much more importantly than that, reduce harm to patients and minimise adverse incidents. The group, as I know, Deputy, you're aware, is chaired independently, which is very important, by an expert healthcare professional, Dr. Rona Mahoney. It's comprised of membership from across the relevant government departments and agencies. With respect to vaccination, patients concerned with a possible side effect or an adverse reaction following a vaccination should, in the first instance, consult with their medical practitioner. They can refer them as necessary to the appropriate services for clinical assessment. It should be noted that vaccines can only be approved and used if they comply with all of the requirements of quality, safety and efficacy. These are set out in the relevant EU pharmaceutical legislation. Any authorised vaccine will be subject to ongoing monitoring here by the HPRA, the Health Products Regulatory Authority, and the latest safety updates for the HPRA regarding the COVID vaccines, as you reference, are available on the HPRA's website. With regard specifically to a vaccine damage compensation scheme, during the pandemic, all available resources in the Department of Health were devoted to the public health response, and that has meant, to be clear, Deputy, the work that you're, I think, quite rightly calling for during COVID was not progressed. It had been the plan to progress it. It was not progressed. So further scoping work will now be required to pull the group together to move this forward again, as we must.
Minister, I have to say that I'm deeply, deeply disappointed from your response. We've had scoping reports done by the Minister for Health, Micheál Martin, who himself, as Minister for Health, gave a commitment to deliver on this, and every other minister since then. We have that height of reports in relation to this. This has been introduced in 25 countries across the globe. And the reality is that vaccination compensation schemes boost public confidence in terms of successful vaccination programmes. And vaccination programmes are vital to maintain herd immunity against a range of diseases. And the emerging academic evidence on post-viral chronic conditions now, such as long COVID, ME and chronic fatigue syndrome, multiple sclerosis, Alzheimer's, Parkinson's and Lyme, viruses are now being associated with these conditions. So we need to have a proactive rather than a reactive approach to this.
Thanks, Deputy. Yeah, and I fully accept and appreciate your frustration. As you say, you've been talking about this for over 20 years. I fully accept that. You'll be aware that it was in mid-June of 2018 the government received a very comprehensive report from Justice Meenan on clinical negligence. The intention had been, my understanding is, in early 2020, just to do exactly what you're calling for, to pull this together, to pull this group together, to look at the international evidence and to bring something in here for exactly the reasons I think you're quite rightly advocating for. What happened was COVID. And what happened was the public health experts, the public health doctors, the CMO, the DCMOs, the bioethicists and all the people we would normally have involved in this, for the obvious reasons, were pulled almost exclusively into the COVID into the COVID response. I hope, let's see, but let's all hope that COVID is now something that is in the rearview mirror, and now is a time we can pull this group together.
Minister, back in 2020, the recommendation was that a vaccine injury scheme should be introduced as a matter of urgency. Now, Minister, you know within the State Claims Agency, within the health profession, there's a culture of fighting claims. Now, we have parents who have been advocating on behalf of the disabled children for over 50 years, where the doors have been slammed in their faces by the health profession, telling them that it's all in their head, and where your predecessor in the 1980s paid a 10 grand compensation package to get parents to shut up in relation to this. It is not good enough that here we are decades later and we're still talking about another report, another review and no action.
Thanks very much, Deputy. I think that's a partial characterisation. The reality is a lot of the work required to do this was undertaken. So on the foot of a request from my department, the Health Research Board did a very extensive evidence-based international evidence review. It looked at Denmark, Finland, Norway, Sweden, China, Japan, Korea, Taiwan, New Zealand, US and the UK. That was a very legitimate part of the work. That was submitted to my predecessor in March of 2019. The very clear advice I have is that the department was fully intent on doing this. It is complex. There are sensitive policy decisions that have to be made. There's very extensive legal advice that has to be had. And all I can say, Deputy, is I accept your bona fides on this. I agree that we need this. And at this point, the only reason we don't have it is because all of the people required to put it together were, for obvious reasons, pulled on to COVID for 2 years. And I think now is a good time to push that work back into action.